The Statistical Institute of Jamaica, Statin, says Jamaicans are generally informed about COVID-19. The institute completed a related survey in September in partnership with the Ministry of Health and Wellness. The survey collated and analyzed data on Jamaica's knowledge, attitude, and practices in relation to the new coronavirus. Statin's Deputy Director General, Lisha Delati Boudier, speaks to the results of the survey.
We also sought to assess the economic impact of COVID-19 on persons. So we had asked persons whether or not they were employed in the first week of March 2020 and whether or not they were employed in the first week of April 2020. And when we looked at that data, what we saw was that there was approximately 270,000 persons who reported that there is a decline in the number of persons employed by about 270,000 persons. We also asked persons about whether or not their income had been affected by any of the COVID control measures. And what we saw was that there was approximately 60% of persons who were employed who were reporting that there was some level of reduction in their income, either complete loss of income or a partial reduction in their income. And we also saw where this was more pervasive around males. And the complete survey report is available from Statin, so you can delve into that a little bit deeper.
She says the survey's findings, which were released at the end of September, revealed that the participants were generally informed about COVID-19.
But what we realized in terms of, for example, the knowledge of persons with regards to COVID-19, while the majority of persons use traditional media, we found, for example, some disparity across the different demographic groupings. So we saw where younger persons were more inclined to get their information from other sources such as social media and WhatsApp, whereas the older age group was more inclined to get their information from official sources. With regards to attitudes around the coronavirus, and what we found was that generally persons perceived that the elderly was most at risk for contracting the virus, and also we saw whereby persons in the western region were better informed and actually were practicing more safe practices such as social distancing. With regards to the actions that persons take to limit COVID-19, we saw, for example, where women were more likely to stay home, whereas men were more likely to report that they socially distanced.
The Deputy Director was speaking at a Jamaica Information Service think tank session at the agency's head office in Kingston this week.